A recent case of alleged abuse, which led to the death of a child in Fitchburg, has many outraged and wondering what can be done to prevent such a tragedy. April is National Child Abuse Prevention Month, and Connecting Point's Carolee McGrath sat down with pediatrician Dr. Stephen Boos, the co-medical director of the Family Advocacy Center at Baystate Children's Hospital, and explained how stronger communities can help prevent child abuse.
I am a pediatrician, so I take care of children, and I've been doing that for 35 years. About 20 years ago, I focused in the area of child abuse. Mostly it's about trying to figure out, when there's a concern of abuse, whether the medical evidence supports abuse being present, or whether the medical evidence says, no, this is not a case of abuse. And then in either case, guiding people to appropriate care so that children do as well as can be expected and their families do as well as can be expected.
So talk a little bit about, as far as preventing abuse, close-knit neighbors as a way to protect kids.
Certainly. So there's actually a very recent paper. I think it's dated 2018. It's brand new. And the researchers took a group of communities and tried to match them for other factors that would influence the rate of abuse and the rate of involvement with what we call DCF, which is nationally called Children's Protective Services. So these communities were matched, but then they surveyed the communities and they asked them, what do you think of your neighbors? Are they people you can trust? Are they people you can go to? Are they helpful to you? Is this a neighborhood that is close-knit? And so now they had this data, and then they grabbed another piece of data. They said, how often have you and your family been involved with Children's Protective Services? And they match and compare those two. And what they find is that in the communities where people trust their neighbors, have relationships with their neighbors, and feel the community is close-knit, the rate of abuse was significantly lower. The rate of involvement with DCF, CPS, is significantly lower. And so that's an example of how connectedness, community connections, is preventive. It's protective of child abuse and involvement with child protection agencies in the families who live there.
This can happen in any community, correct? And any type of family?
Certainly. The rate of abuse and neglect varies somewhat by the nature of community, but there are no communities with no cases. It happens everywhere. Now, often in wealthier communities, communities where people are employed, there is natural connections between people. They're having their get-togethers, their block parties, whatever. Whereas when we get to communities that are higher in crime, higher in poverty, higher in drug involvement, those people are often more isolated in their homes. We need to find ways to get those people together. These are things that the people themselves can do, find neighbors, or find neighbors who are isolated and reach out to them and draw them into a relationship. But these are also things we can do institutionally. We can have community parties, have gathering places. This is what parks are about. This is what community centers are about. So the built environment, the way we plan our urban environments, has a lot to do with it.
Is it so much as far as being connected that, if you know your neighbor and they know what's kind of going on in your house and you know what's going on in their house, there's sort of an accountability and also there's also help from those people as well? Like if you were having a difficult day with your child, is that what helps, decrease those calls?
So what I would say is that's a great question, but that's not a question that's answered by this research. That's logical thinking, and we know that people call upon neighbors for help when they need emergency daycare. We know that they call on neighbors to watch their one child when they have to take the other child to see the doctor. We know that just when they're feeling down and blue and they have someone to go over and have a cup of tea with, that is helpful to people. But to say that the connections are used this way and these are the ones that prevent the abuse, we don't have that data yet.
Okay, talk about sexual abuse a little bit and the importance of communication.
Certainly. So sexual abuse takes place in secret. The abuser knows what's going on, but they've been working with the family to try and get the family to trust them with their child. Perhaps it's their own child, perhaps their step-parent or a mother's boyfriend, or perhaps they're the coach or just someone in the community. But they're working with the family to get access to the child. Then they have to work with the child to get access to touching and games. And then finally the abuse occurs and they have to maintain the secret, otherwise they don't get access again, or they don't get to progress from the milder initial forms to the more invasive, intrusive, and damaging forms that come later. All of this requires trust, which means the family needs to recognize when not to trust, and it requires trust, which means the child needs to recognize when not to trust, and then it requires the maintenance of secrecy. So if we can communicate with families, what are those indicators that someone might be trying to move in on your child too much? When should you say, it sounds like a good thing, but maybe it's not? That's a communication from professionals to families. If families can communicate to children, hey, these are the names of your parts, okay? So if you have to communicate with me about them or things that go on with them, you have words to use. And by the way, we talk about this in our family. This is an open chain of communication. It's not so shameful that you can't mention it. And these are things that you should be on the lookout for. People behave this way, they don't behave this way.
And you have this conversation with kids at what age?
From birth.
From birth.
So when you're changing...
As opposed to just locking them in a room and like, no, you cannot babysit, because that's one way
sure,
that you can do it.
The problem with the talk is that abuse happens before the talk, that the talk does not open up communication, it's a delivery of information. But information delivery isn't the only thing that happens in communication. We're also communicating values. We're communicating about the ability to talk. And by kind of waiting for that magical moment at 10 or 11 or 12, we're communicating that this is a hard thing to talk about and that we don't talk about it in this family. We're making it too special, too precious. On the other hand, if you're changing a baby and, oh, this is your eyes, this is your nose, this is your ears, these are your private parts, or whatever terms you hope to use, but we hope you pick one that other people outside your family will recognize so they can communicate with others. That when you're talking about no hitting, okay, no biting, no kicking, and these are your private parts, if I need to take care of them or if the doctor needs to take care of them, that's okay. But other people shouldn't be touching them. And you are a child. You don't need to help other people. You shouldn't be touching other people's. And if that happens, you need to tell me so that we can take care of it.
And how do kids recover from this? I mean, can you recover from, sexual abuse situation, from child abuse?
So many kids recover perfectly well. That doesn't mean they're not changed. They have memories. They may have made different choices in life. They may have different personality features. But we would say they're functional, they're doing well. Other children have problems. Sometimes they have problems that they can get over with therapy. And a lot of what is done at the Family Advocacy Center is special therapy to try and help children get over these experiences. Some people throughout their lives will have certain areas that are difficult for them, certain problems, and maybe we can make them less, but they will persist and their lives will be affected in ways that they would prefer not to have their lives affected. And then a small percentage of children go on to repeat their abuse with another generation. But that's really a small percentage. So I would say the experience is one that should give people hope for recovery, but shouldn't make us complacent. We still need to prevent where we can. We still need to communicate. We need to listen when children communicate to us and respond, not say, no, I know better.
Right. And just really listen to them. Thank you so much. This is such a difficult topic, but certainly one that we need to talk about, and we really appreciate you coming in today.
You're welcome.